But right now, I'm joined by the Parliamentary Under-Secretary of State for Primary Care and Public Health, Neil O'Brien. A very good morning to you, Neil O'Brien. Thanks so much for talking to us this morning. I wanted to start by asking you about our top story and a report that families in the UK are travelling abroad for expensive brain tumour treatment as they feel they've run out of options on the NHS. Our reporter travelled with a family to Utrecht for brain cancer treatment for their 7-year-old daughter, Jasmine, after raising £250,000. Why are people feeling that they have to crowdfund to pay for treatment of their children?
So we do have more people working in oncology in the NHS than ever before, and more people are being treated for cancer than ever before as well. Now, in the case of some rare cancers, obviously, that is at the frontier of treatment, and we're also investing in research so that for people with those more rare brain tumours, that we can develop the therapies and get them used in the UK to treat those particularly rare and difficult tumours. So, for example, we're investing about £40 million as part of our kind of brain tumours mission to try and bring forward some of those treatments that can save young lives and the lives of anyone with brain tumours.
Well, yes, and you talk about them being rare and difficult tumours, but as I understand it, brain tumours kill more children and adults under the age of 40 than any other cancer. And you talk about that government pledge to spend £40 million towards brain tumour research, but you've only spent 11.3 million of it. Why is that?
I think it's a little bit more than that now, but the key point is every single funding application that has been a valid funding application, we have funded, and that money is still there. We are doing everything we can to get it spent. It's an example where we have the money and we are trying to find the research projects to put it into, and we're not just passively waiting for people to come forward. We as a department are running workshops, engaging with clinicians, encouraging people to come forward and make research bids for that money. We do want to spend the money as quickly as we possibly can. Obviously, there are all the normal rules about how we spend scientific budgets has to go on. Proper research projects, obviously normal clinically led research projects, but we do want to spend the money as quickly as we can. It's not going to go anywhere. We're absolutely going to spend it on what we intended, which is that 40 million priority to do more to accelerate brain tumour research in the UK.
But if those companies aren't coming forward for the money, doesn't that highlight other problems in the system? I know that one pharmaceutical company has told us that they've chosen to hold trials for brain cancer treatment in the US, not the UK. They say that the process for approving a clinical trial is a lot faster there, 30 days compared to roughly 6 months in the UK. Is the UK an attractive enough place to hold clinical trials?
Well, it's not just about companies coming forward. It's also about academic researchers and other clinicians as well, because some of this research is at an earlier stage. Now, absolutely on clinical trials, which is only one part of the research story, we have been doing a lot to try and accelerate the process of getting those approved and to try and get the advantages of having the NHS as a large single system compared to other countries. So that we can get those clinical trials moving more quickly. It's something that the new Department of Science has been working on very actively to try and get the UK to be one of the most attractive locations. And it is definitely one of the most attractive locations to do research, but we are constantly trying to improve on that as well. And so absolutely, it is an area of focus for us.
And what's your message to Jasmine's mum and dad today who've had to travel to Utrecht for treatment for her?
Well, I have a similarly aged daughter, and it is an extremely hard film to watch. So, of course, my thoughts are with the family in that unbelievably difficult, hard to imagine situation. But absolutely, this is why we are putting the extra money into research across the board in lots of different rare diseases, about £1 billion in research in total. And it's why we're trying to constantly improve cancer treatment across the board, because it is such a tough thing to see and such a tough story to hear. And we are just desperate to try and get the money out the door, get the research going, and move as quickly as we possibly can to help people like poor little Jasmine.
To move on to another issue, you're announcing today that all GP surgeries will have a digital phone system by the spring. Now, we already knew that this system was in the pipeline. So what's actually new about today's announcement. Is it a repeat prescription, as Labour says?
So what we see today is that we announced before that we were putting £240 million into new technology for GPs, and part of that is about offering them new, better phone systems, digital phone systems, so that if you ring up, if you're on an old analog system, you can get an engaged tone, and that's terrible, and people are not getting through to their GP. And so we're investing heavily in new technology, both better digital access and also better phone systems, so that people always get through and their call gets managed in a sensible way. And we can start to end that kind of 8 a.m. scramble for appointments that too many people have been experiencing. And what we learned today is that there is huge enthusiasm for this from GPs. There's about 1,050 GPs have signed up to get a proper cloud-based telephony rather than an old analog system. And that's just the start of this program rolling out, as well as the better phone systems. We're going to be upgrading a lot of the technology so that people can do more online, that they can, at a convenient time to them, post their GP images of anything that's wrong with them or have chats with their GP online. And that just enables all these different investments we're making the flow of activity to be much smoother and more effective in general practice. And of course, that is building on a big investment in more people. So we've got about 2,000 more doctors in general practice than we did in 2019, about 31,000 other clinicians, people like pharmacists, specialists like podiatrists, people like paramedics. So there's a big investment in people, and partly because of that, and partly just because of GPs' incredibly hard work, they are now doing more appointments than ever before. They're doing about 10% more appointments every day than they were pre-pandemic, which is about 20 more appointments per surgery every single day. So there is a big increase in demand. We are investing to try and meet that demand, and this new technology is part of that. So you have a better experience, you get through to your GP, and you get the care that you need in a timely way.
I also want to ask you today about Legionella bug infestations and sewage leaks. More than 100 have been detected in the past year in government buildings. The government's called for civil servants to stop working at home and get back to work. But is it safe for them to get back to work?
It is safe for them to get back to work. We have very, very high standards, and I've worked in lots of different government departments, and the buildings have are all to a high standard. And we do have a very cautious approach, and of course, that's why we monitor all these things. We would never ever expect anyone to work in an unsafe environment. I work in the same environment, of course, so we all want the same things. So absolutely, it is true that there's this register of every single thing that's happened in any government building across the entire country, and all the different issues that there have been over a year. And of course, where you're employing a huge number of people in a huge organisation, there'll always be things that are being fixed all the time. But absolutely, it is safe for people to work in the office if they're civil servants or other public sector workers. And we do always make sure that buildings are all done to a high standard. And that is why we detect these problems and then we fix them.
Okay, well, Neil O'Brien, we appreciate your time this morning. Thanks very much indeed.